Climate change isn't just melting ice, it's harming people. We always hear climate change is coming, but the truth is, it's already here, in our lungs, in our food, our water, and health. The climate is changing faster than the bodies can adapt. Heat waves, diseases, floods, hunger. This is not the future. This is today. Welcome back to the channel, and if you're new here, feel at home. It's Nasmamli Ho. Today, we are diving into something bigger than all of us. How climate change is silently reshaping global health. From rising heat that overwhelms our human body to mosquito-borne diseases appearing in new regions, to floods, hunger, mental distress, and polluted air. Climate change is no longer an environmental problem only. It is a health emergency. Let's break down what's happening, why it matters, and how it's affecting millions of people right now. I have created 6 scenes to elaborate the effect of climate change to the world. On scene number 1, it's about heat waves and rising temperatures. Across the world, heat waves are becoming hotter, longer, and harder to escape. When temperatures rise beyond the human body can handle, people develop heat exhaustion, dehydration, and even deadly heat stroke. Outdoor workers, farmers, children, and the elderly are most at risk. But it doesn't just affect comfort, it worsens heart disease, kidney disease, and diabetes. Hospitals see spikes in emergency visits every time the temperatures go above what is normal for a region. And in the low-income communities without cooling, even sleeping becomes dangerous. Climate change is turning heat into silent health crisis. On scene number 2, there is infectious diseases and mosquitoes spreading. As the climate warms, mosquitoes expand into new geographic areas. Diseases that were once limited to tropical regions, like malaria, chikungunya, and Zika, now appear in places where people have totally no immunity. Mosquitoes breed faster in warmer temperatures and stagnant water left behind by floods. This means outbreaks start earlier in the year and last longer than before. Health systems struggle to keep up with the rising cases, and communities that never had to worry about mosquito-borne diseases are suddenly at risk. Climate change is reshaping where and how infectious diseases spread. Scene number 3 is floods and waterborne diseases. Climate change is causing heavier rains and more destructive floods. When floods hit, they contaminate drinking water and sewage and waste. This leads to outbreaks of cholera, typhoid, dysentery, and diarrheal diseases, especially in children. Public health teams work around the clock to provide safe water, but many communities are cut off and displaced. Even after the water goes down, stagnant pools become breeding grounds for mosquitoes. Homes, clinics, and sanitation facilities take months to repair. Floods don't just destroy property, they spread diseases that can devastate entire regions. On scene number 4 is about food insecurity and malnutrition. Droughts, rising temperatures, and unpredictable seasons are damaging crops across the world. Farmers struggle with unpredictable rainfall, sometimes too little, sometimes too much. This reduces food production, kills livestock, and increases food prices. Families face shortages of basic foods and children suffer the most. Malnutrition weakens their immune systems, making them more prone to infections. Countries already battling with poverty now face second crisis, the struggle to feed entire populations. Climate change is turning food insecurity into a major global health emergency. Sin number 5 is mental health and climate displacement. Climate-related disasters force millions of people to leave their home every year. Floods, storms, droughts, and wildfires destroy entire communities in minutes. People lose homes, jobs, schools, and loved ones. In displacement camps, stress, anxiety, and trauma are extremely common. Children develop sleep problems and fear of future disasters. Adults face depression, hopelessness, and uncertainty about the future. Health care workers also experience burnout from constant climate emergencies. Climate change affects mental health in ways the world is only beginning to understand. The last sin number 6, is about air pollution and respiratory diseases. Climate change worsens the air we breathe. Wildfires release massive amounts of smoke, tiny particles, and toxins into the atmosphere. Heat increases urban smog and raises levels of ground level ozone, a harmful pollutant. People with asthma, COPD, and heart diseases struggle the most. Children inhale polluted air at school, adults inhale it at work, and the elderly inhale it at home. Air pollution contributes to heart attacks, lung diseases, and even premature deaths. Climate change is making air harder to find, and it's hurting millions of people. Climate change affects every part of our health, and awareness is the first step towards action. Stay informed, stay safe, and I'll see you in the next video. Don't forget to subscribe for more global health education with me, Nurse Mamli O. Thank you for watching. Goodbye.